What are the rare types of lupus? Lupus is a complex autoimmune disease that can take many forms, and some types are quite rare. While most people are familiar with systemic lupus erythematosus, which affects multiple organs, there are other less common types that are important to understand. These rare forms often have unique features that distinguish them from the more typical presentations. One of the rarest types is drug-induced lupus. This form occurs as a reaction to certain medications, such as hydralazine or isoniazid. Symptoms resemble systemic lupus but usually resolve once the medication is stopped. It is important to note that drug-induced lupus is less likely to involve the kidneys or central nervous system compared to systemic lupus. Another uncommon type is neonatal lupus. This condition affects some babies born to mothers with lupus or certain related antibodies. It can cause skin rashes, liver problems, or heart issues like congenital heart block. Fortunately, neonatal lupus is usually temporary, and most infants recover fully, but it requires careful monitoring and management. There's also subacute cutaneous lupus erythematosus, which primarily affects the skin. It causes widespread, non-scarring rashes that are sensitive to sunlight. Unlike systemic lupus, it rarely involves internal organs, making it a more localized form of the disease. Proper skin protection and topical treatments are often effective. Lupus paniculitis is a rare subtype that involves inflammation of the fat tissue under the skin. It presents as deep, firm nodules that can leave scars. This form is less common and may require specific treatments to control the inflammation. Lastly, there is lupus profundus, a very rare form of lupus affecting deeper layers of the skin and subcutaneous tissue. It often appears as painful, deep nodules or plaques, mainly on the arms or thighs. Diagnosis can be challenging, and treatment typically involves immunosuppressive medications under medical supervision. Because these rare types of lupus are so uncommon, diagnosis can be complex and often requires specialized testing and expert consultation. It's essential for anyone experiencing unusual symptoms or skin changes to seek medical advice from healthcare professionals familiar with autoimmune diseases. Remember, each person's experience with lupus is unique, and proper diagnosis and management are key to maintaining health and quality of life.